In Indiana, our nurses of color represent only 10% of all of the registered nurses. And when we look at that small number, we recognize that we have even less nurses of color who are involved in health policy and advocacy. In January of 2021, we launched a program that's called Empowering Nurses of Color for Health Policy Leadership. Think about the missed opportunity we have when we don't have these nurses of color at the table to be able to contribute to solutions because they know the issues. They live them. This cohort of nurses represent nurses throughout the state of Indiana who have the expertise, who have the leadership skills, they have the day-to-day commitment, working and engaging with patients of all different ages and with their families to enhance, to improve healthcare.
I've had mentors before, but this program was special because I had a mentor that looked like me, and I think that that's a valuable thing. You start this journey and you think that you're alone, but there's other people that have the same interest, the same focus, and we just need to have these platforms to bring us all together. And I hope to be able to utilize what I've learned with my students now and in the future, because they are the future of healthcare.
This program has helped me tremendously in my role as a board member for the Federally Qualified Health Center in my community. It's helped me to be more familiar with current legislation that's impacting our communities of color. And so it's helped us with some of our decisions and some of our strategic planning. It is so important to get nurses of color involved in healthcare advocacy because we are the voice for sometimes those that may not be represented. We can provide perspective, we can provide nuance to many decisions that impact our communities of color.
We are part of a university system that's dedicated to preparing nurses who are a vital part of the healthcare workforce. We are layering on the exposure and the preparation for engaging in policy decision-making and advocacy. We cannot forget that they advocate for patients and families on a day-to-day basis. They advocate for patient populations, and they advocate for key issues affecting Indiana. And so why not expand and to broaden to know that when we look around, that we have the inclusion and we have nurses of color who are vital on the front lines and provide quality care. And let's bring their voices, let's bring their expertise, let's bring their leadership, because we all want a better Indiana.